don't be arrogant.
Both in life, but especially in your work, it's important.
If you don't have the nurses on your side, you are really in deep shit. It's not black and white. What we have learned in the medical school doesn't necessarily fit in the real life. You might think you're invisible in a hospital, but believe me, people are seeing you. They will see what you are doing. Hi everyone, welcome back to Minds Over Scrubs. My name is Ivy. I'm a cardiology resident working in Norway, and as usual, I have my partner with me, Eirik Kjempfjord. And today we're going to talk about don't be arrogant. Well, Eirik, what are you thinking about that?
No, I think that both in life, but especially in your work situation, it's important to not be arrogant or think you are better than others. And I think that it's important to remember that what different people see as arrogant is not the same as you might think. And especially in our field of work, there is a hierarchy. Even though we feel that everybody is the same.
Is it still a hierarchy?
It's still a hierarchy, and I think especially a lot of nurses, healthcare workers, pharmacists, ambulance personnel, whatever, they feel that they are under the doctors. So when you talk to them and secretaries and whatever, remember that you are a team, that everybody is important, and don't talk down to them or say that you are better or it's my responsibility or whatever, because even though you don't feel that you are arrogant, I think they can feel it that way.
I remember starting in my internship. When you go out after finishing your medical school, you are, top of the world. And then I met these amazing nurses who has been working for many decades, and they have seen so much in their job experience. And I think that you need to be humble and ask for help from them, because they know a lot of stuff that you don't know when you go out as an intern.
No, you might think you know everything when you are done, and I know that some of our colleagues, when they are asked, and we do this because I decide. But I usually go the opposite way and say, if I'm at a new department, I say, I'll ask the experienced nurse, but what do you usually do in these situations? Because they know more about this than I do. So and in that way, they are feeling more confident, and they like you and help you, and that can save you a lot of time later on, because then they do more for you.
Yeah, I agree with you. And I have been in scenarios where with other of my fellows and medical students who they probably didn't know how to approach this topic. And I think they didn't necessarily failed. They just didn't know how to approach this thing. And some of them are really bookworms, like they have read everything, they know everything in the books. But in real life, they're like, why are you not doing this? Like, for example, we can take a patient with atrial fibrillation, which is a really common heart disease. And he was like, okay, but this patient got this his symptoms 2 hours ago. Why don't we just electroconvert him? Which is like you're actually going to like restart his heart. And I'm like, well, he's not he's not hemodynamic, is unstable. His blood pressure is fine. He's breathing fine, and let's just give him some anticoagulation, which is a blood thinner for protecting from blood clots when you have this atrial fibrillation. And he's like, but I read in this book that you have to do the electroconversion right away within 48 hours. I'm like, yeah, that's true. But if it's a stable person, you don't have to do that. Then we can just wait for 3 weeks, and then he will come back. And I remember when I told him this, he was like, he seems to be pissed on me. I'm like, why are you not doing the things that is written in the books? And in real life, when you have the life experience and patient experience as well, you don't have to, it's not black and white. What we had learned in the medical school doesn't necessarily fit in the real life. Is that your experience too, Eirik?
Yeah, that's my experience as well. And I think that another thing that's important is that when we work at the hospitals, sometimes you feel that this is a doctor's job, and this is a nurse's job, and this is someone else's job. And I think that it's important to remember that we are a team. And if you are looking at a patient, talking to a patient, and the patient at the same time should have measured their blood pressure or taken a temperature, you can do it. You don't need the nurse to do it for you. We know how to do it, we as well. And I think that if you help each other, everybody will have more time. And if I go in and talk to a patient, then I go out and say to the nurse, no, you can measure the blood pressures and tell me afterwards. Why do I have to wait for that? If I measure the blood pressure myself, I already know the answer. So things go faster if we can collaborate and do things together. And I had an experience when I was a relatively new doctor and resident, and we were having a morning meeting where we were discussing all the patients, and I was standing in my new white coat, and I was new at the department, and one of the nurses was sitting beside me, and I didn't think much of it, and I didn't say a thing during the whole meeting. And the next day I was called into my leader, and she said that one of the nurses had complained about me. And I didn't understand anything because I hadn't said anything or done anything, I thought. But she said now that nurse, she felt that I was arrogant because I was standing beside her and I was so straight in my back.
Really?
Yeah, and I was just, okay, where did that come from? And that's just what I mean about the hierarchy. We don't maybe feel it, but I think there is an underlying sense there that the nurses are not as good as the doctors. But if you don't have the nurses, nothing will work. And remember also the cleaning personnel. If they don't do their job, nothing will happen at the hospitals.
Yeah, I agree. And I feel like when I'm working as a doctor, I don't see myself as a doctor, if you understand. I'm just IFE. I'm just running around and do my task and talking to patients and being in the ER and, that kind of stuff. And I feel like everyone I'm talking to is are my colleagues. Yeah. Whether you're a cleaner or you're a physiotherapist or you're a nurse, whoever you are, I think it's really important just to be gentle to everyone and respect them.
Yeah, and talk to everyone and sit eating lunch with everyone. And remember that if you are at a department and you're having 10 patients or wherever, you spend maybe 5 minutes with that patient during the day. So nurses and the cleaning personnel and others, they spend hours with the same patients. And the patients feel more secure and safer with them. So they tell them a lot more than they tell us. And at my outpatient clinic, many of the patients, they want to receive the treatment, or they want to stay and feel like they do the right things. So they say what I wanted to hear, not what exactly happens. So if you, for instance, you have cancer and you want the next treatment, you say that everything is fine and you tolerate the treatment and whatever. And if you talk to the family or the nurses, they tell you that no, he is lying in the bed all the time, he has fever every day, and he can't do anything. I don't think he can tolerate the treatment. So you have to remember that much of the information is given to other personnel that you actually need to do your job. And if you don't talk to them and you collaborate with them, you miss out at a lot of important information.
So it's basically about having a good communication with everyone.
Yeah, you are a team. Yeah. Everybody is important.
Yeah, and I think like from my experience that if you don't have the nurses, at least the nurses on your side, then you are really in deep shit. Like because if you, I've seen some scenarios like where some could be really not really nice to the nurses. They're talking down on them and like you have to do this and that, and it would backfire on you. Yeah, I mean you don't realize it back now and then, but I promise you, it's not going to be a good thing because everyone talks. And when a rumor begins, then everyone knows. And in a smaller hospitals, the reputation, the rumors will get out there really fast. And it's not any difference in the bigger hospitals, but people see what you are doing.
Yep.
And you might think you're invisible in a hospital, but believe me, people are seeing you. And they will see what you are doing, if you're good or bad.
Yeah, and I think that it will fire back on you if you are an arrogant or a better wizard or whatever. Because if you are helpful, open, always there for discussions, always there to help your colleagues as well, they will help you back. But if you are always like, no, that's not my patient, I don't, you have to do it yourself, then they won't help you when you need help.
But sometimes I wonder, do these people actually know that they are arrogant?
I think that we have some know, but many of them do not know, and they are not told. I think we have a situation now where it's easy to be a net troll or tell behind your back. And it was the same like the story I told about me earlier on. If that nurse just had come to me after a meeting and said that I feel that when you are standing and looking down on me, I feel underneath you and I don't like it, then we just could have solved it us between and we could have talked instead of her sending a message to the boss and I'm getting in on the red carpet and have to defend myself. So I think that it's easier just to send an anonymous complaint or so instead of just telling the person. And as you said, the rumors are going there. So instead of spreading the rumors, why don't talk to the person face to face?
Yeah, but I have never understood that kind of thinking. I kind of understand they want to be anonymous, but isn't it better to actually just talk physically to that person and say, "Hey, I know that you have done. You told me I did this and that and whatever, but could you please, do it in change the way you are behaving yourself or something like that?" I remember I had a medical student. He got a lot of complaints from nurses, and they told me about it. And
they told you, but not him.
No, they told me, but not him. But then I felt it was my responsibility to actually talk to him about it, but like he won't know if nobody's going to tell him about this. So I did have a conversation with him like, hey, I've been working with you and I got some complaints from the nurses regarding your behavior, and then I told him like some cases like they feel like you're talking down on them, like you're better than them, but I want to hear your side of the story. And then he told me like, no, I it's never my intention to be like that. But he had heard about this before from previous job experiences. And then I told him, but is there a reason why you have not changed this behavior? I'm not judging him because everyone has different backgrounds, different life perspectives that makes them do what they're doing. And sometimes they don't understand what they're doing is maybe harmful from themselves and for others. And he told me like, yeah, but I don't know what to do, how to actually change that part. And I didn't know that this person that well. And I was like, maybe you should think about the things you are telling to them. And you have to, stay positive, smile, and just be on their level, on the nurse's level. Like you're not talking down to them like I'm better than you. And I don't think it's a really good answer how to do it, but I can just relate some to myself. Like we all have some not so good good qualities, but for me, it's really important to actually admit to myself that there's something I need to change, because I'm really impatient person. I used to be more patient compared to now. And I was like, okay, maybe I need to count to 10 every time before I'm going to do something. Because previously in my life, I could take some actions that would be not really good because I didn't think before I did it. And I think the most important part as a human beings is to admit to yourself you do have a challenge that you need to improve. But the question you have to ask after that is that, do you want to change? And I think that's the biggest problem for every human being. Regardless, it doesn't have to do with the doctor job. This is just the humanity. We do have a problem, like to admit to ourselves that we do have a challenge, and then when you admit to yourself, yes, I do have a challenge, then you have to follow up another question: do you want to change it?
Yeah, I agree on that, and I think that it's not what you say, but it's how you say it. That's one thing, and the other thing is that if there is a problem, you don't have to find a problem in everybody else. You should look at yourself first, because there are always two sides of the story. So I don't think that necessarily it's your fault, but it can be something with the communication. And I know myself that sometimes I say something before it goes through my head and it comes out wrong. I don't mean anything bad or anything about that, but I just speak without thinking, and I put the words in the wrong context or in the wrong sentence. But I don't think I have said anything bad. It's just the way it came out, and maybe the situation it came out. So maybe you should maybe tell to count to 10 or something sometimes, and then you can take it up in a quiet situation. And sometimes it's not the right thing to say it in front of everybody. You can take the person aside later on and talk to that private and solve the thing. So I think that it's important to not be mean.
Yeah,
you can disagree, but listen to what they say, and maybe it's you that have the wrong answer sometimes.
And you're mentioning a really fascinating, I would say, topic, because because one thing is like you are being arrogant, but if there's someone else who's being arrogant to you, what do you do then? Because there's a lot of challenges when you step into the medical world. You're an intern or you're a new fellow at a new hospital. How do you actually, how do you manage it when you meet, you never met this person, but then they are not that nice to you and they're arrogant. How do you deal with it?
Nah, I'm an open person and I like to talk to everybody, and usually I find that people that some think are nasty or angry or whatever are nice persons if you just learn them to know. But if they are mean to you, I think it's important that you are not mean back. Let them be mean if that's how they are, and just ignore it. And don't spend time with them if you don't need to do that.
Yeah, and I think it was really important here is that when someone is telling you something in a bad way, they are yelling at you or whatever, just remind yourself that there are some reasons for that. First of all, it's not because of you. Mostly, it's not because of you. It is because of them. Either they're having a bad day, and the second one would be they're not happy with their life. And what I've seen is like when you're not happy with your life, you actually don't want anyone else to be happy, and that's the truth. And the third part would be they're jealous, but that would be more in a different. It really depends on the context, of course. But you have to think about when they are yelling at you, because I got yelled too, and sometimes like and then I ask myself, did I actually do something wrong here? And then I have to go through the patient case and everything like that. I'm like, no, I didn't do that, but he was angry for something else, right? And then I feel like, okay, you know what? Maybe they're having a bad day, they're not unhappy or whatever. So don't take that into consideration. Just it's easy to say this, but I too, I'm a human being too. I'm also thinking about, oh my God, I'm thinking about this scenario many times. Like did I actually do something wrong? But in the end, it's not about you. It's just about that person. And I think it's really important to talk about it, because everyone thinks like, oh no, oh my God, he's angry at me, or he's arrogant against me because I did something wrong. But often it's not about you.
Yeah, earlier mentor for me at the kidney department in Denmark, he's sat down with me during a shift once, because I felt a little bit useless, because I've called him for 20 times that shift to ask for help. And I was new at the department, and I was still at medical school, and I felt really insecure, and I called him, and then at the 20th time or whatever, I said, I hope you're not angry at me, because I'm calling you for these minor things all the time. And I said, I love you calling. That's, for me, that's a sign that you are interested, you want to learn. I would be much more worried if you didn't ask for help. And if I ever are angry or short at you or whatever, it's not because you're asking a question or you call me. That's because I have other problems. So the time you stop calling me and ask for help, I'm really worried. And that I really learned a lot of that. And try to take that with me, but sometimes it's difficult. But we are there to help each other, especially those that are younger than us, and try to make their day and life easier and better, and educate them so they can take care of us when we are getting old.
And I think it's a really important message to the younger ones that you can always call us because we're there to help you, regardless of how we can sound on the phone. Please just call us, because it's really important to let us know that you're actually interested, that you're calling us to seek for help or seek a piece of advice or something like that. Because I really get worried myself when I doing some mentorship for some of my medical students or other fellows, that I know they don't have that much of professional experiences yet, and they're not calling me, and then I really get worried. Like, do they do all their tasking? Are they doing a proper work? Are they? Is there something they're wondering about? And that kind of stuff. So yes, it's really important that they do call us, because it makes us more secure too. I don't mind if they're calling me many times, but at least think about the things you're going to ask me before you're actually going to ask me about it. Like, for example, if there's a patient that got a pneumonia, what kind of antibiotics do you want to use? Please, I would highly recommend you to, before calling to me, and ask me, what kind of antibiotics do you use for pneumonia? Just use some time to look up what kind of antibiotics do we use on this hospital. So do some research before you ask for help. We really appreciate it because it really reflects that you actually have been thinking and done some research which kind of antibiotics you would like to treat this patient with, rather than just calling to know the answer from me.
Yeah, I think that's really important before we round this session, because you can always ask for help, but it's allowed to use your brain a little bit before you call. So think through and know the person or patient you are calling about, so you know all the different diseases, comorbidities, whatever, and make a plan that you could think you would go for. And then instead of asking, I have a sick patient here, what do I do? So say, I have this patient, I've thought this and this and this. Do you agree with me, or is it something that I have forgotten or missed? Because then you learn more, and the person you ask feel more secure on giving you the correct answer.
I agree with you, and that is also a piece of advice for us too, because when your learning is never ending, right? And when you eventually get higher up in the I wouldn't say hierarchy, but more like you actually becoming going from a medical student, and then you are intern, and then you're maybe a fellow.
You get more responsibility.
Yeah, you get more responsibility. And someday you will be standing out there alone, and you have to take that decision. And who's going to help you? Well, it really depends on how, if you have good connections with people. But so it's really important that you know how you use your brain to think about what kind of differential diagnosis may I be dealing with in this case? What will I do with further investigation? And do I need some help? And I think that's the most important message for this episode. Don't you think, Eirik?
Yeah, I think so.
Yeah.
I agree.
Yeah, and so please, if there's any questions you would love to ask us, so please just comment below on this episode, and we will love to answer you as good as possible. So thank you for listening to this episode.